Hello everyone, my name is Sofia and today I'm sitting here with Dr. Dipesh Batra, super specialist and MCH neurospine specialist. Welcome, doctor. Today we are going to talk about migraine. So what is it exactly?
See, migraine in a layman's language is a kind of headache.
Right.
But we call it as migraine when you have the recurrent attack of headache and they are of varying intensity and the patient feels nausea and vomiting with the attack of headache. Sometimes they also feel few sensory abnormalities like you can say dysgeusia, like different kind of taste in their tongue, or you can see few sounds in your ears, or you have lightning in front of your eyes, or you feel sometimes abnormal nauseous smells around you when there is nothing that kind of stimuli, but the patient feels sensory symptoms along with headache, nausea and vomiting. Then we can classify or label that headache as migraine.
What are the preventive medicines for migraine?
This is a very good question, as most of the patients are taking preventive or prophylactic medicines. They are medicines which are taken to prevent the attack for the migraine, because we divide the medicines into those medicines which should be taken during the attack and the medicines which are not supposed to be taken during the attack, but there are few medicines which are taken to prevent the attack of migraine. There are many kind of medicines available in the market, the beta blockers, the antidepressants and calcium channel blockers, and there are so many such kind of medicines.
Are there non-medication therapies for headaches?
Yes, the over-the-counter drugs like naproxen, paracetamol, yes, they do work, but they do not work to prevent the attack. Sometimes they decrease the frequency or intensity of your headache, but yes, you need to take the proper anti-migraine medications to protect yourself from migraine.
And do over-the-counter headache medicines work?
Yes, sometimes they work, usually they do not.
How important are lifestyle changes?
See, lifestyle change in a patient of migraine is very important. You should exercise regularly, you should eat healthy and proper diet. You can take few nutritional supplements which they do help, like magnesium, coenzyme 10, and there are few multivitamins which you can take adjunct to your other medications. They will decrease the frequency and the intensity of your attack, and probably some medications which can cause nutritional deficiencies, you can fulfill that as well.
And are migraines hereditary?
Yes, it's a very good question. Migraines, many times they are hereditary because the attack of the migraine occurs at your brain, your CNS, and it occurs at your channel abnormality. Usually there is abnormality in your calcium channels, magnesium channels, sodium and potassium channels in your brain. That's why the scans in the patients of migraine, the MRI and CT scans are totally normal. But the patient is feeling the symptoms of headache again and again and again.
And what is a migraine trigger?
See, migraine can be triggered by anything. You can say lack of sleep, overstressed, unhealthy lifestyle, unhealthy eating habits like butter and chocolates, which are these days are eaten like anything. They can trigger attacks of migraine because then they cause obesity, then they produce oxidation stress, and they can cause migraine. So anything can trigger migraine in a patient, and the patient can better tell what are the triggers to the specific patient. But what I have explained to you are the common triggers.
And how causes migraines?
As I already told you, it is electrolytic abnormalities at the level of your brain.
How do you prevent headaches?
See, first we have to notify and rectify the trigger. Like you should have a proper sleep, good eating habits, good dietary habits. You should take proper food, proper meals at proper time. So lifestyle, I can say, very important thing in a patient of migraine.
Can you please recommend us any herbal remedies?
See, yes, the patient suffering from migraine can take good nutritional supplements in their diet. They can take magnesium, they can take dry fruits, they can take coenzyme Q10, they can take pantothenic acid, and there are few vitamin B complex which can help a patient to decrease the frequency and the intensity of the attack.
And what is the duration of this treatment?
See, because the migraine can last long throughout your life. So these kind of herbal medications or multivitamins and supplements you can take throughout your life, because they do not have any side effect as such, because they are just food supplements.
Thank you, doctor, for joining us today and giving us so much information about the migraines. We know how much herbal treatments can help us out. In order you would like to receive this treatment, you can order it from our website or contact us at the below mentioned number.